Good evening, everyone, and welcome. My name is Tegan, and I am a young apprentice at Operation Diversity Academy. We support thousands of families with neurodivergent children with special educational needs and disability in the UK online. Tonight, I am co-hosting this webinar on the respiratory system and COVID-19 with my mum because she is training me up. Tonight, we are joined by our special guest, Karen Frankland. Karen is the respiratory nurse specialist and teacher with a range of experience within the NHS private healthcare and the pharma industry. She currently works with organisations delivering training and doctors and nurses. Her usual training topics include asthma and COPD. She has been involved in education for 15 years and says she feels privileged to have a job that she loves so much. Karen's Operation Diversity live webinar tonight aims to increase your understanding of how the lungs work, what a virus is, how coronavirus can affect the healthy and vulnerable population. It also aims to provide practical ideas of how to keep you and yourself and your family well. We hope that you all find this webinar useful. If you have any questions, please do post them in the comments and we will ask Karen to answer them for you at the end of the webinar when we do our Q&A. Before I hand over to Karen to start with the webinar, I would like to just say it is a worrying time for us all. So please take care, stay safe and stay well. Over to you, Karen.
Okay, so I'm just going to share my screen first of all. Okay, so hopefully everybody can see that without any problems. So, hello and good evening. Thank you very, very much indeed, and I'd like to also thank Tegan for that beautiful introduction, very professional introduction that she's given me there. That was lovely. Okay. So, as she says, we're going to be having a look at the respiratory system this evening and linking that in with coronavirus and COVID-19. So the presentation will be around about half an hour and then we'll have some time for questions when we're finished. So this is what I was going to include. I'm going to start off by having a look at your healthy lungs, because I think that is something that a lot of people don't fully understand, sort of where the lungs are and how they work and what they're there for. So we'll start off with that. Then we'll have a general look at what a virus actually is before we move on looking more specifically about coronavirus and COVID-19. We'll then look at the impact on the healthy population and on vulnerable people, how we can look after ourselves and others, and I've got a few sort of top tips to share with you. So we'll start off by having a look at the lungs, and the first thing I want you to consider really is do you know where your lungs are? Do you know what they do? And this is a question we ask a lot of patients when we're talking to them, particularly they've got things like asthma or bronchitis, because it's really important to understand first of all where they are. And a lot of people think you've got a couple of perhaps little tubes right high up in the chest with a bit of a balloon on the end. And actually the lungs are a lot more complicated than that. We're a massive organ filling the whole of the chest. So I wanted to show you first this picture of a tree, which you might think is a little one. What you can see is it's got a large tree trunk and then lots of branches coming off, and the branches get smaller and smaller and smaller till they get right to the end where you've got the buds and where the leaves would actually form. And what I'm now going to do is turn that tree upside down, and then if I now show you a picture of the lungs, hopefully you'll be able to see that where they sit within the chest resembles very much this upside down tree. So you've got your main windpipe that divides into the right and the left, and then continues with these tiny branches just like the tree, or what we call smaller and smaller and smaller, and what we call the little air sacs. And the main function of these branches or airways is to make sure that we can get air in and out of the lung without any obstruction or any problem. So we breathe in and out nice and freely. So I mentioned a minute ago about the air sacs, and this is really important part of your lungs. And again, I'm going to show you a bit of a strange picture of a bunch of grapes. And this is because we often refer to the air sacs as looking like a bunch of grapes. This is exactly what they look like deep inside the lungs. And the reason that they're arranged like this is so that we've got a really large surface area for the air sacs to do their job. And the job is that when we take a big breath in, our air sacs then become full of oxygen, and the oxygen has to pass across the wall of the air sac, and it then gets into your capillaries and your blood vessels. And your heart is a big pump, and that's pumping that blood then all around your body with the oxygen in it. And the oxygen is then utilised by all the different cells and the tissues in your body. So they all need oxygen in order to work effectively and produce energy. And a waste product of that energy being produced is another gas, which is called carbon dioxide. So that's a waste product. It's harmful to us. We have to get rid of it very quickly. So again, that moves into the blood. The heart pumps very hard, gets the blood back to the lungs, and then you breathe out, and the carbon dioxide is breathed out very effectively with it. Okay. Now, this again seems another strange picture to show you, but if you actually unravelled all your lung tissue and all these air sacs that are inside your chest, you'd actually have enough to cover the full size of a tennis court. So imagine all those tiny air sacs squashed inside your chest. So very, very large organ and very effective at the job that it does. And the other thing that's really important to mention is lots of people think that your lungs are here at the front of your chest, where actually the vast majority of your lung tissue is at your back, in your back. And I'd like you to just hold on to that thought and remember that, because I'm going to come back to it a little bit later. So now you know a little bit about your lungs and what they're there for. What I wanted to have a look at now is just explain a little bit about what a virus is. So this is a picture of a virus, obviously magnified to a very large size. And in simple terms, a virus is a germ, and if it enters the body, it can cause disease. So what it does is it enters the body and sits inside one of your cells, and then it uses part of that cell to reproduce itself, which then means once it's been reproduced, it can start infecting other cells that are nearby. Now, usually, most commonly, a virus enters the body through the nose or the mouth. But if you think about your own body, and wherever there is an opening, a virus can enter the body that way. So probably the least said about that, the better. And we've got thousands of different viruses that have been identified, causing a range of different diseases, and some of these will be really familiar to you. So there's one called rhinovirus, and when a virus has been identified, what we then do is look at different strains. So when we look at rhinovirus, there's at least 100 different types of rhinovirus, and the disease that it causes is the common cold. Now, one of the main reasons why a vaccine hasn't been developed for the common cold is this very reason, is that there's at least 100 different strains, so we'd never be able to capture all of them in a vaccine. Obviously, influenza causes flu, a viral infection that you'll all be familiar with. And another one is rotavirus, and there's probably a few of us on the call that unfortunately have experienced this as well, and this is usually linked to poor food hygiene, so it's linked to diarrhea and vomiting. So how do you treat a virus? Not sure if any of you have got any ideas there. Well, basically, you've got an inbuilt system within your body that's your natural defence mechanism to help protect you from anything harmful. So most viruses are killed by your immune system. That's your natural defence. And usually you recover quite quickly, anything from a few days to a few weeks. But one really important thing probably to mention at this point about a virus is it's very different to a bacteria. So bacteria is another germ that causes diseases. but different to viruses. For one thing, viruses are hundreds and hundreds times smaller than bacteria and cause different types of diseases. Bacteria are treated with antibiotics, but the appropriate treatment for a virus, unfortunately, is not an antibiotic. So what can we do to treat it? Key thing is drink lots of water, try and flush the virus out of your body, and take regular painkillers. So paracetamol, or what we often refer to as NSAIDs, and what this stands for is non-steroidal anti-inflammatory drugs. And again, you'll be familiar with this. This is brufen, ibuprofen. This is really, really good at as a painkiller, but also at reducing temperature. And the other thing that's key if you get a virus is to stay at home, like we're all doing at the moment, to try and minimise the risk of actually passing it on to anybody else. So those are your key things for treating a virus. A lot of time and effort has been put into actually preventing viral infections in the first place, and we've got a lot of very effective vaccination programs in place. So for those of you that have got children, obviously you'll be familiar with things like the measles vaccination to prevent that terrible disease. Hepatitis B is another one, that's a bloodborne infection. And anybody at risk, sort of the elderly or anybody with chronic long-term conditions, has a flu vaccination every year to prevent them from getting flu. Now what happens is there is a component of the virus inside the vaccine, but it's been changed or sort of diluted, if you like, so it isn't actually capable of giving you the disease, but it helps your immune system to fight it. So for example, if you have a flu vaccination, it prevents you from flu, it gives you the flu. So that's virus specifically about coronavirus and COVID-19. And just to try and explain a little bit more about these two terms, because I think there's been a little bit of confusion about why we've got these two different types of terminology that we're using. So the name of the virus is coronavirus, and there are a number of different coronaviruses, like there were with rhinovirus I mentioned before, and this particular one is a new one. And the illness that you get, or the disease that you get if you contract coronavirus, is called Covid-19, which is a new illness that affects the lungs and the airways of humans. So at the end of last year, December 2019, there was an outbreak in China. And what the World Health Organization did earlier this year was identify this new coronavirus and COVID-19. It can affect your upper respiratory tract, so that's things like your throat and your nose and your sinuses, and also your lower respiratory tract, which is what we had a look at before, so your main windpipe and your lungs. And the symptoms range from being very mild to very serious. And as you're all aware, because of all the information that we've had so far, this is a virus, like most others, that spreads very, very quickly due to person-to-person contact. So common symptoms to look out for. First thing to know is that very often you can have had the virus for quite some time before you even experience any symptoms. So anything for between 2 days and 2 weeks. And in fact, some people have the virus and never have any symptoms at all. So it sort of creeps up on you. But the key things to look out for, first of all, is a high temperature. So you don't need to have a thermometer at home for this. What we usually say is if somebody feels very hot to touch on the chest or the back, that is sufficient to be able to say you've got a high temperature. Along with that is a new and continuous dry cough. So it's not a cough where you're coughing up lots of mucus and phlegm. It's typically a dry cough. And what they mean by continuous is that you are literally going into sort of a coughing fit, really, that lasts for about an hour. And cough, 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 cough. Very often, if that's with children, they're sick at the end of it because of the muscles that they've been using to cough. And that the cough happens usually 3 or more times within a 24-hour period. So it's a cough that's new and continuous, and alongside that, people experience shortness of breath. So those are the 3 key main symptoms to look out for. So what causes new coronavirus in the first place? Well, the first thing to say is doctors aren't 100% sure about this. But what we do know is that as well as it affecting people, it can affect different species of animals as well. And it's actually shown links to snakes, bats and anteaters. Now then, you're probably aware that there was a particular area in China where this all started. So very early on, there were a number of people that had been linked to a visit to a large live market where they have seafood and animals. And you may have heard of these before, that they're often referred to as wet markets. And the first cases have come from animals they think that have been sold in that market and then spread very rapidly from one person to another. So thinking about the impact on the healthy population, then the first thing is that absolutely anybody can get it. Nobody's immune. Most infections, most infections are usually mild, and I think sometimes it's very difficult when you're listening to the radio or watching the news and it's the main headlines all the time to get bogged down with all these facts and figures and statistics, and obviously they're homing in on the people who are critically ill and in hospital and sadly who have died. But most infections that people get are mild, and that's very true to say for most children and young adults. Once somebody has got the virus though, it's very easy to spread droplets from the respiratory system when they cough or sneeze, and droplets can actually carry quite a long distance, 6 feet, approximately 2 meters. So again, this is the reason why they're asking us to do the social distancing and keeping 6 feet away from other people if you do have to go out, so that the droplets, if they do land, aren't landing anywhere near you. And the other thing that I think is quite surprising is that if the virus is sort of coughed or sneezed and lands on the surface, it can exist on hard surfaces for quite a long time. So for example, if it lasted on a surface that was made of copper, it can linger for 4 hours, cardboard up to 24 hours, and plastic or stainless steel for 2 to 3 days. So it's quite a hardy little thing, this virus. So if you're just thinking about surfaces in your home or if you're out and about, and I've got some top tips in a minute to help try and minimise your contact with things on various different surfaces. So then thinking about, so that's sort of the healthy population. Then I wanted to talk a little bit about the vulnerable population, and the first thing is to identify what do we actually mean by that, because this is a word that's bandied about quite a lot. And basically what this means is there's certain groups of people in our population that if they got coronavirus, they're much more likely to get a much more serious type of illness. So the first group who would be identified as vulnerable is anybody of any age at all, underlying health condition. So that might be that they've already got a problem with the lungs, such as asthma, C.O.P.D. They might have chronic long-term heart disease, or an immune system that's weakened because they've got certain underlying diseases or treatment that they might be on that's reduced their immune system, so they can't fight germs as easily. One group of people that would encompass was people with cancer. And then we've also got people with diabetes who would be classed as a vulnerable group. Obviously, the elderly would be classed as vulnerable, so anybody over 70 needs to take special measures. And particularly have been identified that a key group for us are men in their 50s and 60s. And here's our lovely Prime Minister, who luckily is well on the road to recovery now, but not very long ago was actually in intensive care very poorly. So age 55, right in the middle of that age group that's been identified for men. So we need to be looking after them. There's a lot of data now that's coming out of these intensive care units, and what that's showing is that the average person who is critically ill with COVID-19 is male and aged 60. And if you look at all the age groups, the death rates are higher in men than women across all ages as well. And there's a number of different reasons for this. Now, this is quite a generalisation, but what we tend to find is that on the whole, men, first of all, are much more likely to have heart disease, diabetes, chronic lung conditions. They generally have too much salt in their diet and eat too much red meat and processed meat. Perhaps don't eat as much fresh fruit and vegetables as they should. Possibly drink alcohol to levels higher than are recommended and actually even up to hazardous levels. And also they're more likely than women to smoke and smoke more per day and use hand-rolled tobacco rather than ordinary cigarettes. Now, they do know that there is an increased risk with COVID-19 if you do smoke or vape, although this isn't fully understood, the connection. But it sort of goes without saying really that obviously if people are smoking or vaping, that then increases your risk of getting any type of lung condition, or if you've got an existing lung condition, it will make it worse. So what sort of things can we do to help? We need some practical advice. Now, this first photograph is designed for a little bit of comedy element. I don't want you to think I'm encouraging you to go around dressed like this with the full high-vis gear on. But basically, just think very carefully about within your homes and what sort of things you're doing and wiping down these surfaces, because it's so important, as I said, because the virus can linger for a long time. So things like light switches, I certainly didn't used to wipe my light switches down with the frequency that I'm doing now. And if you've got a number of people in the household using light switches, it's quite important that you do that, along with door handles. The other thing is being kind to your postman and making sure that you're wiping your letterbox, and thinking about when parcels are being delivered, wiping things down, particularly if they're made of cardboard, because the virus can linger on that. Now, I'm sure your toilets are all beautifully clean, but on the flush and making sure that's being wiped down with a disinfectant wipe at least daily, and handrails for when we're going up and downstairs. Now, it has been said that your remote control for your television and your mouse for your computer has more germs on it than a toilet seat. I don't know how true that is, but think about wiping those down regularly. Telephone screen, iPads, keyboards, all those sorts of things. And then the other thing is when it's your bin day, again, your bin's made of plastic, the virus can hover on there for 2 to 3 days. So when you're bringing your bin back in, take your disinfectant with you and wipe down the handles before you touch anything. Similarly, when you're going out and doing your weekly shop, I know a lot of supermarkets now have got like little cleaning stations, but I've taken to carrying some disinfectant wipes in my handbag now, so I'm wiping the trolley before I've even got into the shop. Obviously, this is a message that we've been taught and recommended to do for months now. So washing your hands as often as you can with soap and water. The alcohol-based sanitizers are good, but nothing is as good as washing your hands with soap and water, and everybody in the household should be encouraged to do that. Now, I don't know what mechanisms you're all using, but singing Happy Birthday twice through has probably got a bit boring by now. So I'm sure there are other songs that you've developed as families. The other thing to consider is making sure the water's warm enough. So don't wash your hands in cold water because it's not as effective as warm water. Staying at home, except for the limited purposes that have been outlined for us by the government. And if you do have to go out, making sure you're practicing those social distancing and staying at least 6 feet away from others. Don't touch your face. I think it's quite alarming, actually, the number of times you do go to touch your face without thinking about it. I do apologise, sorry. And the other thing, very important, at least doing one form of exercise every day. So for keeping children and families safe, there's obviously clear advice from the government and the N.H.S. And a couple of other things I wanted to add is just making sure you're prepared. So for example, making sure that if anybody in your family is on tablets and medicines, make sure you've got sufficient supplies of those. If your child does become unwell with a fever, the first line thing to do is just use the normal medications that you would do, so your paracetamol or brufen products if it's appropriate. If you've got regular appointments at hospitals and clinics, unless you've been advised otherwise, make sure you attend those. And I know they're running very good systems now, certainly at GPs near where I live. You sit in the car park and then you get a text when it's your turn to actually go in. So they're minimising the number of people that are actually entering the building. And keep in touch. So there's lots of online networks and things, and all this information I'm sure is available to you. This is something else that I found from the Well Child website, and it's a poster that if you have got a vulnerable person that's identified in your household, this is something that you can put up in your window. So asking people to definitely leave deliveries and then sort of knock on the door and run, because things might be vital that you're waiting to receive. You don't want people to take parcels away. And just identifying or reinforcing that if people are delivering things and they've got a cough and a cold, definitely not to be entering the house. So that might be something that you want to have a look at. In terms of additional help from the NHS, there's a link here that I've put on for you, and some really interesting things, because it's not just about your physical health, it's about maintaining your mental well-being and managing anxiety. So there's a lot of information on the NHS website on the Every Mind Matters. And Public Health England have also published a lot of advice for parents on carers looking after the mental well-being of children and young people during this outbreak. So there is an awful lot of help and information if you just know where to go for it. Other practical tips. First thing that I think is so vitally important is keeping a daily routine, trying to keep your week separate from your weekend. So still setting an alarm, getting up, having a shower, getting dressed. There's a tendency to think, well, it'd be all right to just stay in my pajamas all day, but I think everybody does feel better for that. And then treat yourself to a bit of a lie-in or what you would normally do at the weekend. The other thing is maintaining as healthy a diet as you possibly can, lots of fresh fruit and vegetables. And I have obviously importantly included lots of chocolate on there, because that is vitally important for everybody's well-being, I would say. Don't know if anybody's got lovely cats or dogs at home. Obviously we know that the virus doesn't affect our lovely pets, and sitting and having a cuddle with your pets is excellent for your mental well-being, and I think a lot of animals are keeping us all going at the moment. Try and get as much fresh air as you can, and even just natural sunlight. So even on the days where you can't get out, make sure you've got lots of natural sunlight coming in, and maintaining some sort of social contact, which obviously we're doing now. I mean, doing all these webinars and things is all brand new for me, because I'm used to doing face-to-face teaching in classrooms. But keeping in touch with people like that, having cups of coffee and a little video call, really important and helps to lift your spirits. And I don't know if any of you are fancying a little bit of online yoga or anything a bit more strenuous than that. But again, there are lots of family classes and things that we can all do together. And when I was putting the presentation together, I came across this and I absolutely love it. And I think it's so pertinent for us at the moment. So this is a quote from Albert Einstein: "Life is like riding a bicycle. To keep your balance, you must keep moving." And I think some days you're a bit more wobbly on your bike than you are on others. But I really, really love that quote, that picture. I've got a little breathing exercise to share with you now. And it's very easy to do. I don't know if you want to have a go while I'm talking you through it. But this has been something that's been recommended by the respiratory doctors and consultants. And this is an exercise that's been done with the doctors and nurses in ICU for a very long time, not just linked to COVID-19. And it helps patients when they've got an active infection. But actually, it's a really good exercise to practice while you're well, And this could perhaps be something that you could share with friends and relatives. So if unfortunately anybody did end up getting the active infection, if they practiced this exercise in advance, it'd be a lot easier for them to do it. And the whole objective of this breathing exercise is so that we can deliver the most amount of oxygen to the lungs as we possibly can. Now, one of the things that happens with COVID-19, if you can imagine it in your mind's eye, if you think of a sponge, so a brand new sponge that's nice and dry, this is a little bit and the oxygen moves in and out without any problem. Now imagine that that sponge has been sunk into a bowl of water, and you lift it out again and it's now sodden and heavy. And this is a bit like what happens when you've got these type of respiratory infections, and you've now got to try and move the oxygen in and out of soggy wet lungs. So what this breathing exercise does is help to facilitate that movement of oxygen as much as we possibly can. And because if we don't, patients will go on and develop other problems such as pneumonia. So here's what it is. First of all, we're going to do 2 cycles that include 5 deep breaths, a breath hold and a breath out. So I don't know if you want to do it with me now. So we're going to do nice big breath in, pause, and then breathe out. And we do that 5 times. So 5 nice big deep breaths in and a pause and a breath out. And then when we've done that 5, I want you to then do a really big cough. But before you do your cough, make sure you've got a tissue or something covering your mouth. So 5 nice big breaths in and out and a big cough. And then we go back to the beginning and repeat that again. Another 5 breaths in and out and a big cough. Now, if you're not used to deep breathing like this, so you don't do yoga or meditation or anything, just be careful, because when you first start practicing, you might make you feel. Once you finish those 2 cycles, this is the best bit now, you're able to have a lovely lie down. But the key thing here is that you must lie on your tummy, lie on your front. So remember I said right at the beginning, I wanted you to remember that most of your lung tissue is in the back of your chest. So if you lie down on your back, you're squashing all those little tiny branches and airways. So lying on your tummy allows all those airways at the back to expand nicely. So you're lying down on your front now and doing slightly deeper breaths than normal, but not as deep as your big ones you were doing before. And just lie there for 10 minutes and do that. So that's a nice relaxing breathing exercise to do and practice every day. Perhaps we'll all do it together as a family. But really good advice, and remember that's come from the consultants at Queen's Hospital in London. The other thing that you might be interested in, if people have got iPhones, is there is an app that you can download, which is a Covid-19 symptom tracker. And again, this is something that's been developed by King's College in London and also Guy's and St Thomas's in the research department. And what you do is you have the app on your phone, and they're asking you to report symptoms every single day or report your health. And it's in order to help get as much information we can about the whole population of the country to try and fight the outbreak. And they want you to report daily, even when you're well, because they want to look at pockets of where we've got lots of well people, perhaps to compare to pockets where there's a lot of COVID-19. So it's going to help the scientists and the researchers to identify the high-risk areas in the UK and look at who's most at risk and how fast the virus is spreading. So it says here take a minute each day, but literally if you're healthy and well, it takes about 10 seconds. It's just 2 questions about your health, and then you click done, and that's it till the next day. So I would encourage you and pass that on to your friends and family. So the more people that are doing this and symptom reporting, the more information they're going to get. So I've just got one final bit of advice for you. Going back to the bins, during lockdown, make sure you're always as glamorous as possible. Lifts your mental well-being. So thank you very, very much for your time. Thank you again for Tegan for that wonderful introduction. and I'll go back to Sarah, I think, now, so that we can see if there's any questions. Thank you very much.
Hello, thanks very much for that, Karen.
Okay.
We have a couple of questions that someone has already sent in, but if you're watching this webinar now on Zoom, can you please pop your questions over into the Q&A box so that we can ask Karen and work through them. If you're watching this session on replay, largely because we couldn't go live on the Facebook page, I really do apologise for that. Do post any questions that you have through to the Facebook page, and if I can't answer myself, Karen, would it be possible if I sent you an email?
Definitely, yeah, no problem.
Okay, lovely. So would you like question one?
Right, question one. Okay, geez. Once schools return, are there any extra measures that parents of children with respiratory issues should try and insist on? Both my boys have chronic lung disease from a
being born prematurely. Yeah. So that means that the babies have been born early, Tegan. It's very common for babies that have been born early to have problems with their breathing. Yes, definitely. I think firstly, from the government, there will be very clear guidelines set out about schools reopening and what sort of measures need to be put in. But I think separate to that, each school or after school club or care facility should have their own policies and procedures that have been put in place. So I think before you boys go back, you need to see copies of that and make sure that everything's in place, that you feel safe and secure in the knowledge of when they're there. All the policies are there for you.
Yeah, because there's a lot of speculation, open the schools.
Yeah.
And I just think it's quite reckless, and if they were to do that, then we would very quickly see another wave.
We would, and it will be done very carefully, and there'll be a lot of thought and consideration and advice from the experts before that happens.
Yeah, thank you.
Okay.
Right, so the next question is, do you know if respiratory challenged children can get face masks on prescription?
I don't. I am aware certainly that there is a big lack of face masks and things at the moment, but no, I think that will probably be a question that you'd have to direct to your GP or your practice nurse.
Yeah, I know some pharmacies are selling them and
high cost.
Yeah, at high cost. I think it was like £2.50 for a small paper face mask, and actually there are hundreds of people sat at home right now making their own face masks. Some people are making them to donate to N.H.S workers, family members, so you don't have to be an absolute expert with a sewing machine, but you can improvise.
I watched a video on how to make face masks, and you can even make a face mask out of a bra.
You can.
Impressive. Wow.
But you have to be careful though that your bra size doesn't cover your whole face.
Yeah, and make sure the bra is clean, because otherwise you'll just blow in loads of dirty
sweat.
Yeah, I hate sweat.
We also need to consider that we need to be very clear on the advice about how face masks work, and people don't get carried away by thinking that that's the only thing that's going to protect them. I think my understanding is that if you've got the infection, it stops you coughing over other people, but it's limited what it can actually prevent. But we're still waiting for clear guidance about face masks for the general public.
The other thing as well that I've noticed a lot on social media, where people are posting pictures of gloves and face masks just thrown on the floor. So they're suggesting have a bag with you, so if you do need to change over, you can dispose of it safely.
It's been disposed of. Yeah, really important point. Yeah.
Okay, next one.
All right. Will masks help with avoiding infection?
Yeah, so that's going back to what I was just saying before. I think we're still waiting for some definitive evidence to tell us about that. So no, it will help if you've got the infection. It will help prevent the spread of the droplets, but won't necessarily help you the other way around.
Lovely, thank you. Next question.
Hi, if someone has had the virus and recovered, could they still pass on the infection to others, say on their hands?
No, once they've recovered, no, there's no risk of the infection carrying on then. One of the main risks is that, as I said, you can be infected for up to 2 weeks before you even have any symptoms. So you don't know you've got it and you might be passing it on then.
Oh.
Oh dear.
All right, so the next question is, I have heard that asthma is no longer considered to be as big as a risk as first thought. Is this the case?
Is that in relation to COVID-19? Yeah, so
Yeah.
Anybody who's on regular treatment for asthma is still in an at-risk or vulnerable group, and the key thing is that you must make sure that you're taking all your regular asthma inhalers as normal, particularly your steroid inhaler if you've got one, to make sure your asthma's under control.
Okay. My dad has asthma.
Oh, to say.
Mm-hmm.
Okay, next question.
All right, next. Why are patients ventilated on their front?
Lying on the front.
Yeah.
Again, that's because, you know, as I was explaining before about getting as much oxygen and the airways at the back ventilated as much as possible, because most of your lung tissue is at the back. So if you lie on your back, you're squashing all those airways.
Yeah. All right. Can you scroll it down more? Right. Next. Stop scrolling. You're giving me a headache. It's literally like it's hurting my eyes. Right. Next question. I am shielding due to lung conditions. I am worrying about sending my son back to school while I am shielding, and then having to do social distancing with him.
Yeah, and I fully understand that. So a bit, probably refer you back to the First Lady's question about when he does go back to school, making sure that the policies and procedures are all in place, and that's a specific risk if he's then going out and about and coming back into the house. Yeah.
All right, next question is from someone called Kylie. I like that name. All right, my son is on Seretide and Montelukast. Yep.
Well done. Yeah.
I would like to know whether he's able to attend school currently, even if just one day a week (a week). He has EHCP, so is able to attend if able.
So he's able to attend if.
From that point of view, it's just whether or not he can from his asthma. Yeah. So again, I think you'd have to get specific advice from your GP or practice nurse about that on an individual basis. But generally speaking, if he's well controlled on his Seretide and his Montelukast, and he's not got any asthma symptoms and he's not waking at night or anything like that, so he's well at the moment, I think there'd be a good chance that he will be okay to do that. But I would prefer that you got specific advice for him from your GP or practice nurse.
Okay, thank you.
All right. So the next question is, by Julie Greenwood, I have, what does that word say?
Bronchiectasis.
Bronchiectasis.
Yep.
Yeah.
And have pneumonia 3 times. Usually get a chest infection every year.
Yeah.
Am I in the vulnerable group category? I have not heard anything from my GP. I'm a teacher and want to know if and when schools open, I can return to work.
Yeah. So I would say yes, there's no doubt that you are in that class as one of those vulnerable categories because of risk of infection because of your lungs already. I'm very surprised I haven't had a letter. I really am. So again, you'd have to speak to either your GP or if you've got bronchiectasis, I don't know if you're somebody that's under the care of the hospital consultants anyway. So seek advice from either one of those.
Okay, thank you.
Thank you. All right, so the next question by Rachel Jones. I really like the name Rachel as well.
Don't read out the full surnames though, please.
Okay, I just like all the names. They're really nice.
Next question.
Right. With the breathing exercises, do you need to breathe in through your mouth or your nose in/out breath?
Oh, yeah, good question. So whatever is comfortable for you, ideally, breathing in through your nose,
Yeah.
pause, and then breathing out through your mouth if you can, but whatever feels comfortable for you.
All right.
Okay.
Good question, yeah. They're all good questions.
Next question here.
Next question. Do you know if having an edema on vocal an edema on vocal cords would put you more of a risk COVID?
Right, yeah, I don't know the answer to that, I'm afraid. So again, you'd have to get specific advice. Sorry, can't help with that one.
All right.
Do you have any questions? Excuse me. If anyone else has any questions, please put them into the Q&A box or the chat box. Do you have any questions about coronavirus, COVID-19?
Yeah, what are the ages that it can kill you? Like,
Oh my goodness, what a question. Well, unfortunately, at any age, but usually that's because people have got other underlying health conditions, so they're quite poorly anyway. In the normal, healthy general population, it's much more likely to be much older people.
yeah.
Anything else?
Putting you on the spot. Did you find it useful? That's the main thing.
Yeah.
Hopefully people have learned something.
I think it's been quite worrying because you hear, I mean, wasn't there a newborn baby that was born and
with the coronavirus?
I think this is the problem. Probably one of the things I should also say that we should do is try and minimise the amount of media things that we're looking at, watching the news and listening, because you do get a bit overwhelmed with it. And don't forget that the media are only giving you slices of information and not the full story. So when you're hearing about newborn babies or young children, there'll be a lot of other underlying things that we're not being told about. So
did you get you know, when we spoke the other day, we were talking about the DNRs?
Oh yes, yeah. Yeah, no, I've not been able to get any more information about that, but that is worrying, very worrying.
Yeah, so we were hearing, obviously, the SEN world was in uproar because N.H.S had released guidance, about issuing DNRs for people.
Holding it.
Sorry, one second.
I like the heating of it.
Neurodivergent households. Sorry. So people are vulnerable or considered, you know, autistic with learning difficulties were being offered DNRs, which is absolutely horrifying. Like your biggest nightmare as a parent, you know, you don't want to be going to hospital and to find out your children, you know, could potentially be denied critical care on the grounds of being neurodivergent. But N.H.S did do a fast U-turn. Everybody, disability sector, kicked off royally, complained, and they did reissue new guidance. So if you are sent a DNR, you know, send off a strongly worded complaint with new update from N.H.S, and if you do find that you're having to go into hospital, you know, make that very clear. I will post for this webinar. I have seen a letter online. I couldn't find it today, but I will track it down, and it was a letter that you can take with you. So should you need to go into hospital, you can print off this letter and take it with you, just in case, you know, you find yourself in a situation, in that situation. Basically, I don't want to, you know, scare anybody, because it shouldn't happen. They do have the frailty scale, but being autistic or having learning difficulties, you know, it doesn't make you any less of a person. You should still receive critical care. Most of frontline workers should have been targeted with the updates. Everyone should know this now, but just in case, you know, stand firm. I will, as I said, I'll find this letter to take with you, but just do everything you can to, you know, try and prevent yourself from getting in that situation. I know a lot of people have been having garden parties and barbecues, and, you know, it's just horrendous. And I went to the shop.
Says you, we had barbecue the other day.
Yes, it's different when it's your family. And when I went to the shop, they had a bell outside, so I was like, sorry.
I'm taking a selfie.
They had a bell outside, so I touched it with my elbow to go in.
Yeah.
And when I got inside, there were loads of people in there. I was thinking, because my husband had said they had like a 2-in, 2-out policy, but there were loads of people in there. I went to go down an aisle and there was some guy stood there, went to walk towards me, and I told him to stop and to go around the other way. And when I got to the till, there was a woman stood right at my backside, and I just said, can I have some space please? And then they wanted me to pay on my card, and then they opened up the till right next to me. I was like, please just give me a minute to pay and get out of here if you're going to do that. And I said to them as I left, you're supposed to be enforcing social distancing. They should be at least 2 meters apart, and you're supposed to be reducing your numbers into the shop. So, you know, if you find a shop like that, then avoid like the plague. But pretty much.
A plague? What's the plague? Oh yeah, I know what the plague is.
Stay away from any of these places if they're not following the guidance to stay safe.
Yeah.
Can't believe she's doing this. It's fun. Okay, I don't think we have any other questions.
Okay.
Breathing exercises, that's it. No, I think that's it. I'll come back to you if we do have any other questions that I can't answer from the content from the webinar. I will let you know.
I will be here on the next webinar as well, because I'm an amazing host. SLP.
Okay, you're going to say thank you to Karen for joining us tonight.
Thank you, Karen.
You're very welcome. Thank you for asking me. It's been lovely to meet you.
Yeah. Thank you very much. Take care, and everybody
stay safe and have fun.
Yeah.
And remember, stay glamorous.
Stay glamorous.
Yeah, stay glamorous.
Out your bins.
Put your bins out.
And if you do, I know Heidi Maver, I think her name is, who's one of our mental health first aiders. She did a challenge within her community, and she was posting or getting people to post pictures of them in full makeup and full dress, like they were going for a night out, just because it makes you feel good doing that. Do what you can to maintain your mental health, and come and check in with us if you do need support. Tegan's been incredibly well behaved today, but you know, obviously we as parents, it can be challenging at times, so please do come and ask us if you need any support.
May I recommend, if you have a VR set, if your children are like very stressful, put them on VR, because right now I'm just obsessed with it, and my mum said, because I've been good for this, I might be able to go into VR a bit just before bed, because I normally sleep a bit later than the rest of the kids because I'm the eldest. But I do recommend VR. It's absolutely,
because she's the eldest and she doesn't sleep.
I'm going back onto melatonin.
Okay, so everybody, good night. Thank you very much, Karen.
Bye. Thank you. Welcome. Bye.
Bye.